So let me start off, friends, in this presentation with talking about tooth preparation for an anterior tooth to receive a metal-free restoration. Now, when I say metal-free restoration, मैं कौन सा material बात कर रहा हूँ? I am definitely not talking PFM. Okay, I am talking either a lithium disilicate, which is an Emax restoration, or I am talking about a porcelain fused to zirconium restoration. Either of these, typically for an anterior tooth, will give you the most ideal aesthetics. And we all know, friends, कि एक central incisor को बाजू वाले central incisor से match करना is probably one of the more difficult things that we do in dentistry, right? So I am always of the belief that आपका जो structure foundation होता है ना, वो सबसे important होता है. Now, if you look at these really tall towers, right, that grab our attention, they look so beautiful when you look at them. But वो खड़ा क्यों है? क्योंकि उसका foundation strong है. And remember, before the construction starts above the ground, the first thing that they do is always lay the foundation that's underneath. And our underneath foundation, friends, is our tooth or crown preparation. So I've just put up a picture, and I really like this picture because what I've done is I've showed the underlying preparation, the final prosthesis, and I've kind of created a translucent effect which tells you कि final outline prosthesis का कैसा होता है और underlying tooth preparation हमने कैसा करना चाहिए. So if I were to remove the prosthesis and go down into the tooth, you can clearly see that principles of tooth preparation that we all have read for, सिर्फ वाइवा देने के लिए नहीं, सिर्फ थ्योरी एग्जाम पास करने के लिए नहीं, बट एक्चुअल क्लिनिकल प्रैक्टिस के अंदर ये सब एग्जीक्यूट करने के लिए all of those principles need to be followed if you want to achieve success on a repeatable basis. वो कहते हैं ना, एक बार एक सक्सेस फॉर्मूला पकड़ लो और फिर वो ही दोबारा रिपीट करते जाओ. So my mission here is to give you that success formula so that you can go back to your practices and probably today evening onwards, start putting it into immediate implementation. All right. So remember, what is important is you want adequate amount of reduction, labially, proximally, palatally. Okay. At the same time, labially, हमें चाहिए कि हमारा margin equigingival हो. Okay. हमारा tapered preparation ho so that we don't encounter any undercuts when we are seating the restoration. Okay, we want a very smooth surface, we want adequate amount of palatal clearance, and we want a definite anatomy and a margin design. All right, so all of these aspects is what I will try to cover in this webinar. Let's jump in and start with first giving you ideal values for amount of tooth reduction. Okay, ideally हमें कितना tooth preparation करना चाहिए. Okay, so I've divided the surface, as you can see, into 1, 2, 3, 4 and 5, and in the box on the bottom left you can see ideal values. Okay, so let's quickly dwell into each of these. First, अगर हम labial aspect पे cervical margin की बात करें तो वहां पे ideal amount of tooth preparation is between 0.8 to 1 millimeter. Now, हम सबने एक स्केल देखी है, स्केल के अंदर 1 मिलीमीटर बहुत छोटा सा दिखता है, right? But when you're checking it on a tooth, actually it looks a sizable amount. Okay, and it's important that you have the desired amount of reduction in this region. Okay, then coming to the labial face, which is number 2. Here you need a slightly more amount of reduction between 1.2 to 1.5 because this is the aesthetic area, right? You don't want the underlying tooth to show through significantly. So the question now arises कि भाई मुझे पता कैसे चलेगा कि मैंने 0.8 कर दिया है, मैंने 1 कर दिया है, कि मैंने 1.5 कर दिया है. So that is where, friends, a pre-treatment putty index comes into the picture, right? The beauty about this webinar, friends, is for the first time, right? Let me go ahead and harp over the fact that for the first time, I have pre-recorded an entire video where I will show each and every step without cutting any corners of how should you be preparing an anterior tooth. In there, I have demonstrated how to make a pre-treatment putty index because it serves as a brilliant guide to check the amount of labial preparation. All right, so this guide, as you can see, tells me cervically मैंने कितना reduce किया है, body में कितना reduce किया है. But in my opinion, labial aspect का जो सबसे important surface है ना, is the margin. And margin design or margin architecture is extremely important if you want aesthetic restorations, and one that flushes with the preparation margin without creating an overhang. All right, so let's dwell into understanding the ideal burr that we are supposed to use for metal-free preparations. And friends, this is a DC or a TR burr. A DC stands for deep chamfer, a TR stands for taper round, right? And when you look at the geometry of the tip, it has actually a spherical edge present. Now, the key understanding for any deep chamfer burr is that you need to use the burr only half its depth. So you will sink the burr only half depth. You will not sink the burr the entire way. As you can see on the image on screen in the middle, burr ko maine sirf half depth dala hua hai. Okay, now why is that half depth so very important, friends? Because that half depth creates what is called as your deep chamfer margin. Right? When you take a burr that is rounded at the edge and you sink it half depth, वो automatically आपको deep chamfer देता है. And remember, metal-free restorations, ideal margin design is deep chamfer. Okay. Now look at this margin design. This margin design is what we have all learned in our books as rounded shoulder or modified shoulder. All right. This is not your typical 90-degree butt margin, but the internal line angle is a little rounded. ये हम सिर्फ और सिर्फ PFM porcelain fused to metal prosthesis में यूज करते हैं. We do not use shoulder margins for your metal free restoration. So remember, metal free कर रहे हो तो आपको सिर्फ और सिर्फ deep chamfer margins ही prepare करना है. Now, why is that half depth so very important? Because अगर आपने half depth से ज्यादा sink कर दिया, like you see on the picture on the left here, it will result, friends, in what is called as lipping of enamel. So look at this picture. I mean, you will wonder to yourself, ये क्या किया हुआ है? This is classic lipping. Okay, this is called as a J-hook preparation. अगर आपका deep chamfer burr half depth से ज्यादा चला जाता है ना अंदर, तो automatically ये unsupported enamel रह जाता है उस तरफ. And then this enamel is, remember यहाँ पे stone पे तो cast में तो stone में होता है, it just chips off very easily. And then क्या होता है कि आपका कास्ट पे मार्जिन अलग हो गया है, पेशेंट के मुंह में मार्जिन अलग हो गया है. So the crown does not seat the margin correctly. All right, so it's important that we stay away from lipping of enamel, and that is why your deep chamfer burr, remember once again, should always be sunk only half its depth. That is key. Okay. Now it's very important, friends, to know the diameter of the tip. अगर आपने 0.8 या 1 mm margin prepare करना है तो आपको diameter पता होना चाहिए. All right, and that is why through this webinar I will be introducing you to this kit that I have personally designed myself. This kit, friends, is an advanced Bur kit by MIK Dental, where 19 different burrs have been put in together to make your work extremely systematic. Right, and through the video I will help you understand कि एक individual burr उसका डिजाइन मैंने क्यों वैसे किया है और उसे किस तरह से ideally हमें यूज करना है. So that will follow in the video that comes. Okay. Now, very important also to remember is whenever you're doing your labial preparations for anterior teeth, always prepare them in two planes. You have the cervical plane, you have the incisal plane. So look at this image here. You can clearly see कि मैंने burr को cervical margin में half depth डाला हुआ है. Okay, and with the help of this, I will make these 3 depth grooves. These depth grooves guide me कि मैंने कितना reduction करना है. Okay, now what I do? I change the orientation of the burr. So look, from a plane 1, which is towards the cervical, I have straightened the burr into a plane 2. And with this, I make more grooves. कभी 2 बनाते हैं, कभी 3 बनाते हैं, कभी 4 बनाते हैं. That is dependent on your own method. आपको क्या जमता है. Okay. But the important thing here is now when you reduce in plane 1 and plane 2, your final preparation will also follow what the adjacent tooth looks like. तो क्या होगा ना, पेशेंट ऐसे नहीं बोलेगा कि डॉक्टर साहब ये दांत आपने किया ना, ये बात थोड़ा सा बाहर लग रहा है या थोड़ा प्रोमिनेंट सा लग रहा है. That problem will not arise. So remember, on the labial face you have plane 1 and you have plane 2. Cervically 0.8 to 1.0 reduction. Labial face 1.2 to 1.5 millimeters of reduction. Okay, now let's come to the next aspect of an anterior tooth, which is the incisal edge. Incisal edge पे हमें कितना reduce करना है? 2 मिलीमीटर, flat out. सोचने की जरूरत नहीं है. हम ये 2 मिलीमीटर क्यों करते हैं? Remember, the entire aesthetics of an anterior tooth comes from that incisal edge, the halo effect, right? And I've outlined the halo on this right central incisor. And now when I overlap the halo onto the adjacent tooth, you can clearly see कि वो incisal edge पे अगर मैंने 2 मिलीमीटर reduction कर दिया ना, so I'm giving my technician a lot of room to create that lifelike or that biomimetic aesthetic appearance. अगर मेरा reduction 2 मिलीमीटर से कम है, so there will be less amount of clearance for my technician to work with. So make sure on the incisal edge, it is extremely important that you not reduce less and definitely not reduce more also. Okay, so that is to do with your incisal edge reduction. That is your 2 millimeters. All right, let us move further into understanding palatal reduction. Now this is often a critical area because the amount of reduction that you do on the palatal face cannot be objectifyingly understood. Okay, that is where, friends, again, I'm going to introduce you to this tool that I have designed, which is called as the prep gauge. Now, prep gauge is available in 4 different thicknesses. What you do is once you've completed your preparation, you put your prep gauge in. Let's say for an anterior tooth, you want about 1 millimeter or 1.5 millimeters of clearance. So you put the prep gauge, ask the patient to bite into it, and you try to pull through. If the gauge comes out, you know for a fact that you have adequate amount of reduction. If the gauge gets stuck, और रिडक्शन करने की जरूरत है, नहीं तो टेक्नीशियन कॉल करके बोलेगा डॉक्टर साहब क्लियरेंस थोड़ा कम है. So this will in an objective manner help you quantify the preparation. ज्यादा है या कम है. At the same time, you could use these paints. As you can see on screen, there is a red colored paint which is RT Spot. This is a paint that is available from the company Bausch. You can place it there, you can ask the patient to bite into it, and most importantly, you can even ask the patient to go through the entire range of protrusive movement. अगर आप central कर रहे हो, अगर आप canine कर रहे हो तो patient को right lateral, left lateral के लिए भी बोल सकते हैं. Alright, so wherever the preparation is less, right, the red mark will be transferred onto the tooth that you are preparing, and it's a landmark. This area you have to selectively reduce. Right, so this adds a lot of predictability to your work, and make sure that on the palatal face you don't land up with high points or under reduction, which is something that in the laboratory is commonly seen. So these prep gauges are a brilliant solution to that problem. Right. Lastly, what's very important is once you've completed your entire preparation and you look at it from the incisal view, you should be able to see all 360 degrees of your preparation. Right, it tells you that there are no undercuts in your prep, and that incisal edge preparation should not be very thin, it should not be very thick, and it should kind of follow the same profile as the curvature of the arch. So in brief, this is what we do when we look for when we are doing preparations for an anterior tooth. Now I believe pictures give you a certain message, but when it comes to a video, I think life becomes a lot more clearer, which is the reason why it's time to dive in and look at a video, friends, that I have pre-recorded, where there will be a prelude followed by an entire description of the burrs and the prep gauges, followed by how do I actually use these to prepare an anterior tooth to receive a metal-free restoration. So enjoy this video, and when we come back, we shall continue with the topic of impression making. Requesting the guys at the back end to please play the video for our lovely audience, please. Thank you.
So friends, a small pre-recorded video where I'd like to share with you details of the armamentarium that we use for our crown and bridge preparation. All right, but before we go there, I'd like to share a small incident that happened a few years ago with me. I remember this was the time when I used to go consulting as a prosthodontist to different clinics, and I noticed that a lot of dentists made one very crucial mistake. And what was that? They would prepare a tooth for a prosthesis, go ahead and make an impression, give a temporary, and then sit and discuss with the patient, "Acha batao, ab cap kaun sa wala dalenge?" And I would be amazed. You know why? Because the sequence, friends, is absolutely incorrect. Tooth preparation protocols are dependent on the type of prosthetic material chosen. This is with respect to margin design and the amount of tooth preparation done. So you know what's right, friends, is to first discuss with the patient and confirm the type of prosthesis, go ahead and then prepare the tooth and proceed with the rest of the prosthetic work. Now I also remember a lot of confusion that clinicians have is अगर मुझे PFM करना है तो मुझे कौन से burrs use करने हैं, metal free करना है तो कौन से burrs use करने हैं, and there's a lot of dilemma, right, about this. Why? Because we have multiple different margin designs that are available. We remember reading from our wonderful fixed prosthodontic textbooks like Schillenberg, Rosenstiel, Tillman, that we have margins like we have the shoulder, we have the chamfer, the deep chamfer, the knife edge, the feather edge, with and without a bevel. And we'd always find ourselves confused in clinical practice. Bhai, ab mujhe kaun sa follow karna hai? So remember, it's very important to know about all these margins from a theoretical standpoint. But when you come into actual execution, the number of margins are not too many. So the confusion not always is with respect to which burrs do I suppose, which I am supposed to use, but with respect to also the diameter of these burrs. Now let me just give you a quick example. TR13, right? That's a commonly used burr in the market. What does TR stand for? TR, friends, stands for taper round, which is to do with the shape of the tip of the burr. And 13 is a denominator with respect to the millimeters in terms of width of the burr. Now I'm an ardent believer, friends, that the most important part of the burr is always the tip, because that's the one that's going to do the preparation, right? But the number 13 actually denotes the diameter of the burr at its widest circumference, which means the portion of the burr that connects to the actual shank. Now in my head, this is not too critical for me. Why? Because the shank of the burr, which is the widest area of the burr, probably never touches the tooth. The concern here is I don't know the diameter of the tip, which is the most important dimension for me. Which is exactly the reason, friends, I have gone through the arduous task of designing a unique kit, which is the Advanced Crown, Bridge and Veneer Preparation Kit. A kit which I always believe speaks to you, because it tells you which burrs are supposed to be used for what kind of preparations, and most importantly, they tell you the tip diameter of the burr. So let's dive right in and look at the Advanced Bur Kit for crown and bridge preparations. This is how the kit is commercially available. So let's go ahead and unveil the same. It comes with a small manual which is in the form of a sheet that allows you to understand every individual burr. But this is exactly what I am going to describe to you in the video. So this is how the kit actually looks. And as you can see, the kit is divided into clusters. Alright, so these are 7 different clusters, and you have 19 different burrs that are available in the kit. And these are all gold series burrs, which means they are coated with a fortifying layer that allows you to prepare teeth faster, and also the fact that these burrs tend to last longer than regular silver burrs. Let's jump in and have a close look at what is the coding that I have provided to this kit. Now let's look at the fact that we have a kit that allows you to choose burrs for PFM preparations, for metal free preparations, interdental, occlusal, cingulum, allied, and then porcelain veneer. So let's look at all of these individually. The very first burr in the kit, friends, as you can see, is the MS 1.0. Now what does MS stand for? MS stands for modified shoulder. Remember, we discussed this burr earlier in the webinar, that this is supposed to be used for PFM preparations on the buccal, mesial and distal margins. Alright, so this is your MS burr. 1.0 stands for the diameter of the burr at the tip, which means when I sink this burr full depth into the tooth, it automatically gives me a 1 millimeter margin. The second burr in the kit, friends, is the DC 1.0. Now DC stands for deep chamfer. So when I use this burr, it automatically gives me the deep chamfer preparation margin. 1.0 again is the diameter of the burr at the tip, but remember, we have to sink the DC burr only half its depth into the tooth, which means this burr, when I sink in half depth, will give me 0.5 of a millimeter preparation, which is what I desire on the lingual aspect of a PFM. The next burr is a finishing diamond, which is the F burr. As you can see, it is red ring, which means this is supposed to be used wherever I have prepared the margin with the MS 1.0. So MS 1.3F is the finishing burr for my buccal, mesial and distal margins in a PFM preparation, and DC 1.2F, as the very name suggests, is supposed to be used for finishing the margins wherever I have used the DC 1.0. Use these burrs for your axial preparations and you know exactly how much you have prepared and what is the architecture of the tip at the preparation site. Now let's look at the next cluster, friends. This is your metal free preparation. Right, so again you have the DC 1.4, which is supposed to be used for, again, as half depth, and this gives you a 0.7 millimeter margin, and then you have the finishing ring, which is supposed to be used for finishing the preparation wherever I have used this particular burr. Now these burrs are the ones that I will be using to demonstrate to you the metal free preparation for an anterior tooth as we move ahead into this particular webinar. Let's look at the next cluster, which is the interdental. Alright, now this is an MI burr. Now MI, friends, stands for modified interdental. Now what is the modification that I have done with this burr? These are regular taper fissure burrs, but with the tip being non-cutting, which means there are no diamonds at the tip of these burrs. Now why have I done this modification? Now it's common that when I start my preparation on the buccal aspect supragingival, by the time I run through into the lingual, कई बार क्या होता है, interdental papilla को burr जाके touch करता है. Now this is because the interdental papilla, remember, is the shape of a coal. Alright, so in the interdental contact region, if my burr starts nicking or hurting the interdental papilla, there's going to be bleeding. Alright, and my margin, more importantly, has gone subgingival. That's not what I desire. So if I have no diamonds at the tip, remember the position at which I start is the same position at which I end as I go from my buccal through into the lingual aspect of the preparation. So that's the beauty of the MI burr. Now there is a 0.8 and a 0.5 variant. The wider one is used for larger teeth like molars and for PFM preparations. The thinner one is used for more delicate, slender teeth like anterior teeth, maybe premolars, especially if you are doing metal-free preparations. Now the next cluster, friends, is your occlusal reduction. Alright, these are straight burrs and you have the OR 1.6 and the OR 1.2. Where will I use the OR 1.6? On the buccal aspect for PFM preparations, because I need 2 millimeter reduction, so I need a thicker burr. On the non-functional cusp, I don't need as much reduction, so I can easily go ahead and use the OR 1.2. If I'm using these burrs for making metal-free reductions, I will only and only use the OR 1.2 because metal-free reductions do not need as much occlusal clearance. Alright, so that's the reason why we have two different diameters for our occlusal reduction series. Next I come to the cingulum reduction. Now cingulum reduction again is a CR 2.8 and a CR 2.3, which is the widest diameter of the burr. Now where will I use the 2.8? I will use the 2.8 if I have to do preparations, say for a maxillary central or a maxillary canine, because remember these are wider teeth, right? So they need more preparation. I will use the less aggressive the 2.3 millimeter burr for maxillary laterals and for all lower anteriors, because remember these are smaller and I need a smaller burr to prepare the teeth. Moving forward, let's look at the allied cluster. Right, this starts with the EC 1.4F. Now EC, friends, stands for end cutting. So this burr only has diamonds at its tip. Where will I use this burr? Interproximal region. Alright, remember we are always concerned about what is called as iatrogenic damage, that when I'm running the burr interdentally, I might land up nicking the adjacent tooth. Alright, and I don't want to do that. Now because this burr has absolutely no diamonds adjacent, that is on the side, I'm never concerned about hurting the adjacent tooth. The only place where the burr is active is its tip, so it allows me to smoothen the interproximal margins. The next burr, friends, in the cluster is IR 2.0, which is an absolutely brilliant burr for incisal reduction, and through the video I will show you how to use this burr to get an exact 2 millimeters of reduction at the incisal edge, which is what we desire on this surface of an anterior tooth. The next burr in the kit, friends, is your CA 1.6F. Now what does CA stand for? CA stands for ceramic or composite adjustment burr. Now where will I use this burr? Once I have taken my articulating paper marks and I want to adjust interferences or high points, that is where this particular design along with its red ring provides accuracy in the amount and position of interferences that I go ahead and eliminate. The last burr in this series, friends, is the DC 1.0 SS. By now you would have understood this. DC stands for deep chamfer, 1.0 is the tip diameter, SS, friends, stands for super short, which means this is a really tiny burr. Where will I use such a short burr? In areas that are difficult to access, which means if I'm working on the distal of the upper 7, which we all know is difficult to access, or if I'm working on a third molar, or if I'm working for a patient who has a small mouth opening, I know this burr is going to come to my rescue. Right, the last cluster in here, friends, is the porcelain laminate veneer burrs. That's your PLV. The 0.3, which gives me a depth groove of 0.3 millimeters, and 0.5, which allow me to quantify the amount of preparation that I achieve when I am doing conservative preparations for anteriors like porcelain veneers. And the last one is your DC 1.2 EF. EF, friends, is extra fine. That is why you see this is a yellow ring burr, and it is used to polish the preparations where I have an Emax or a bonded restoration that I am going to be working with. So friends, the beauty about this entire kit is the fact that it allows me to prepare all teeth in the oral cavity, anteriors and posteriors, and at the same time I can do all types of prosthetic preparations, be it metal, be it zirconium, be it monolithic Emax, or be it porcelain fused to metal. Alright, so this kit adds predictability to my work because it allows me to gauge the margin, and it also allows me to quantify the amount of preparation, making sure that my technician can clearly see the margin and more importantly has adequate room to build the restoration into. There is still one concern area that I know a lot of clinicians and technicians always have these debates with, and that is, Doctor Sahab, clearance thoda kam lag raha hai. Now, how do we normally check for clearance? It's either visually or with the help of wax. Now this does not tell you whether the reduction is adequate or not, right? It does not predictably tell you that, which is the reason why, friends, I'm going to present to you this beautiful tool that I have designed that comes in this really lovely packing, which is called as the prep gauge. Right now, prep gauge is nothing but 4 silicone grade feelers that allow you to quantify the amount of reduction that you have achieved. They're available in this autoclavable box like this. Right now, these are available in 1 millimeter, 1.5, 2 millimeters, and 3.5 millimeters. Different gauges for different kinds of occlusal or palatal reduction. Right, these gauges I will show you during the video can be used to quantify whether you have reduced adequately or not. You can use also use different paints or sprays that are available in the market to gauge exactly where the reduction is less, thereby allowing you to predictably ensure that your technician is provided with the correct amount of reduction. Alright, so these small tools, they significantly improve the quality of dentistry that we perform. Now, what is another beauty about both of these gadgets? The fact that these can be placed back into their slots, can be pouched and put into an autoclave, which means you can sterilize these, making sure that you are able to use these repeatedly, especially in a time where COVID has troubled us and our patients. We can be that much more thorough in our procedure as we provide care to them. Now let's jump right in and start with a video demonstration of how to use these tools to prepare an anterior tooth to receive a metal-free restoration. So friends, before you start with actual tooth preparation, it helps to make a small putty index. Right? This putty index is used to quantify or gauge the amount of reduction that you have achieved as against the ideal amount of reduction. So at the end of preparation, this gauge allows you to make changes if there are any needed. Like if you want to make further reduction, you can easily go ahead and quantify that against the gauge and thereby reduce further. Alright, so what do I use? I use only and only putty. What putty am I talking about? I am talking about C silicone. Alright, C silicone, which stands for condensation silicone, but in my world it is also cheap silicone. Alright, because you have a lot of putty that is available for a relatively small price. So what do? I first go ahead and adapt the putty around the teeth that I have to prepare. So what will this do? This will go ahead and record the anatomy of the unprepared tooth structure. Now, how is this important for me? It is important for me, friends, because I can go ahead and section the putty along different planes if I need to, and then use it at the end of preparation to gauge whether my labial preparation, my incisal edge reduction, or even my palatal reduction is adequate or not. Now, when is this helpful? This is helpful especially if you are doing anterior aesthetic cases, or if you are starting off with your tooth preparations, or if you are unsure whether you are reducing adequately or not. When you are a beginner, it helps to use this on a regular basis. Why? Because है ना, धीरे धीरे आदत पड़ जाती है, समझ में आता है कि कितना रिडक्शन आइडियल है या कितना हमें और करने की जरूरत है. So in my opinion, it's the best form of personal training and checking whether you are providing the adequate amount of clearance and reduction for your patient and also for your technician. Remember, we do not want to under reduce, and at the same time we do not want to land up over reducing and then weakening the tooth structure. Okay, so go ahead and make this in putty. You do this directly in the patient's mouth. Alright, once this is set, I go ahead and I simply push this out. I remove this, and this gives me a beautiful anatomy registration of the original tooth structure. What do I now do? I take a blade. Right, I could use a regular surgical blade, or I could use a putty cutter. I go ahead and run through and through, all right, through and through the tooth that I want to prepare. Okay, so as you can see here, I'm going to go ahead and sink this all the way through and cut across. So what does this do? In one slice, it breaks the putty index into two pieces. Okay, now when I position this back onto the unprepared tooth beforehand, you can see this is beautifully adapted to the labial face. Right, now once I am through with my preparation, I can gauge the amount of reduction that I have achieved against this putty index and thereby add predictability to my work. So now let's jump in and start with the actual preparation, because I feel my patient is becoming a little impatient. Alright friends, so we're going to go ahead and prepare this left central for either an Emax or a porcelain fused to zirconium based restoration. Remember, the preparation design for both remains the exact same. Okay, now because this is a metal free preparation, the first burr that you see on my air rotor is the DC 1.4 burr, right? I'm going to sink this burr first in plane 1. In the cervical region, I'm going to make 3 grooves, sinking the burr half depth. Then I'm going to straighten the burr out, and then I'm going to make more grooves. This is in plane 2. So remember, we first work in plane 1 and then plane 2. All right, so look closely as I sink the burr half depth into the tooth in the cervical plane. Alright, now I want all of you all to notice that when I'm doing this, I'm keeping the burr actually supragingival, right? Slightly. Now why do I do this supragingival? Because when I'm finishing my preparation, I can easily go equigingival. If I start equigingival, when I'm finishing, I might land up going subgingival, and that's not what I desire. Alright, so I've made one groove here, and I'm going to make one more groove here. Once again, keeping the same burr angle and sinking the burr half depth, and then one here. So I have 3 grooves that are 0.8 millimeters and are present in plane 1 of the tooth surface. Alright, just gonna go ahead and highlight this to you. Alright, these are your 3 grooves that are made in plane 1. Okay, now if I were to show this to you from a slightly different angle, here you can see that half the burr tip is sunken into the tooth, which means I have tentatively a 0.7 millimeters margin. Alright, now typically I need a 0.8 at this margin, so the remaining 0.1 millimeter, friends, will come from the finishing burr that I use. Alright, now that I'm done with plane 1, I will go ahead and simply change the angle of the same burr and work in plane 2. Right, so remember, this is my plane 1. I'm going to straighten the burr out, and this gives me the plane 2. Let's look at the same thing from a different angle. This is my plane 1. Right, you can see the shank of the burr not touching the tooth, only the tip is. Now when I straighten it out into plane 2, can you see more of the shank is now touching the tooth? That's exactly what we desire with respect to plane 1 and plane 2. Okay, so that was your plane 1 reduction. I now straighten the burr and I make more grooves here. Again, the same principle of sinking the burr half depth, and that's all you need for a metal free preparation. Alright, and I'm done with these labial grooves. Alright, I'm going to show these to you again. If you want, you can make more grooves. Again, that's something that is a personal choice. Okay, so you can clearly see there are grooves in plane 1 and there are grooves in plane 2, as it is obviously evident from this angle as well. Now what do I do? Now I have to go ahead and connect these grooves. Basically, whatever enamel is present in between these grooves, I am supposed to go ahead and remove that enamel island out. Okay, now what helps at this point? It helps to probably go ahead and mark the base of the grooves with a pencil or with a marker. It's just a guide for you so that you know you have performed the adequate amount of reduction or not. That's just again a tip that I would want youngsters to start incorporating into their regular day work. Now remember, when you go from one groove to the other, it is extremely important that you do unidirectional strokes, which means you go from here to here, come back here, and then go here again. It's important that you don't do front and back. If you do this motion, remember these grooves are going to continue to deepen out, and then you'll get a very corrugated or a speed breaker like surface. So remember, you start here, you move laterally, which is where the burr is in contact with the tooth. You lift it up, you come back to this groove, and then repeat the stroke. Alright, so you get unidirectional reduction. Okay, so let's go ahead and do that towards the cervical. I'm going to connect the center groove to the mesial groove and then the center groove to the distal groove. All this only and only in plane 1 to begin with. Unidirectional strokes, slow and steady. Remember, you're not in a hurry to finish your preparation. You do this very, very slowly and very gently. Slowly keep moving out as much as you can towards the proximal. Alright, unidirectional strokes. right? Just unidirectional strokes. That's all I need. So I've worked from here and I've moved up till this region. Now holding the burr in the exact same angle, I move towards the mesial. Sorry, this is the distal. I've already done the mesial, so now I'm moving towards the distal face. All right. Remember, very gentle strokes from one direction only. All right. And then just run through so that you can smoothen everything out. At this point, even if there are a little bit of unevenness in the surface or some roughness in the surface, don't worry. Because remember, we are going to finish the preparation. At this point, this is just gross reduction. Right? So here you can see there is gross reduction that has been achieved on the labial face in plane 1 only. Now what do I do? Using the same burr, which means I haven't changed my burr at all. I'm going to work on plane 2 of the labial face. So what do? I hold the burr in the plane 2 angle and I run through from one groove to the other. Once again in a unidirectional stroke. One groove to the other. Slow and steady. Right, and then with this groove you can continue to move outwards. Now the important thing is you move outwards, but you do not go ahead and touch the adjacent tooth. Alright, you don't have to go all the way because you still have to do proximal preparations. Alright, one groove. Now I go towards the distal. Keep moving in a unidirectional stroke. Right, now even after I've done this, it is not uncommon for the labial surface to have a lot of groove marks still visible. Right, if you can see, those grooves are still visible there at the base. Right, now it's not uncommon for a lot of clinicians to start chasing these grooves only to land up over reducing the tooth structure. Right, so small tip that I'd like to share with all of you here. Okay, all you need to do at this point is from a straight angle just turn the aorta face. Alright, so don't change the angle. So plane 2, all I'm doing is I'm changing this inclination. Now when I run across, this burr is selectively going to go ahead and reduce only the islands and not touch the base of the groove at all. And this automatically lands up giving me a much smoother labial face. Right, once again, slow and steady wins the race. Once you gain confidence with this, you could probably start working faster. But remember, initially, it helps to work with a extremely gentle and smooth flowing hand. Alright, and do this very, very gently, very, very smooth, and you will see that the preparation begins to even out. Right, as you can see, those grooves are now almost completely vanished. Yes, the surface does look rough, but remember I mentioned rough surface is okay because we will come back and finish the preparation. Right, but when I look at this preparation from a slant view, okay, can you see we have a definite plane 1 reduction and a definite plane 2 reduction. Okay, so just highlighting that same again for you, this is your plane 1 reduction. This is your plane 2 reduction. Now your plane 2 is always a lot longer as compared to your plane 1, because when you look at the adjacent central as well, this central will always have a cervical bulge which is a short distance, and then you have a long straight profile. Now incisal edge also ideally has a plane 3 that you would see here. Okay, but we don't do plane 3 reduction because remember at the end of the day we're going to go ahead and do incisal edge reduction. So अगर एज रिड्यूस करने ही वाले हैं तो प्लेन 3 रिडक्शन की जरूरत हमें पड़ती ही नहीं. Alright, so just plane 1 cervical, plane 2 which is the long incisal. Alright, at this point you go ahead and now swap your burr. Alright, because this burr has already done the majority of its work. Now we will move into interproximal preparation. So what burr will I use for that? Now because this is an anterior tooth, okay, so I'm going to switch on to the MI 0.5 5 burr. All right, very quickly I'll show you the MI 0.5 burr. Alright, so here we see the MI 0.5. MI stands for modified interdental, 0.5 is the tip diameter, and remember the fact that this burr has absolutely no diamonds at the tip. Okay, what am I supposed to do? Interproximal reduction. Now when I am using this burr, I want to start off interproximally, run through from the labial into the palatal, keeping a thin film of enamel here. This thin film of enamel, friends, will make sure that the adjacent tooth does not get hurt when I am going ahead and preparing the proximal face. So this has to be done in layers. All right, so I keep moving downward as I move into the palatal face. So look closely, I keep this burr towards the interpapillary lesion, all right, and I run through and run through. As I run through, the groove deepens, and at one point my burr will slip out. Almost there, and my burr begins to slip out completely. All right, so the level at which I start is the exact same level at which I end. That's the beauty about this particular burr. All right, and it's gone through and through. All right, let me quickly show that aspect to you. Okay, see, the burr has gone literally through and through from the labial into the palatal face. All right, so see how beautifully thin this structure is now. All right, it allows me to make sure that the adjacent tooth is not hurt as a part of my proximal preparation. Now with the same burr, I do the exact same thing towards the distal margin as well. So I keep the burr slightly above the papillary region. So if this is your papillary region, you will keep the burr slightly more coronal to it, and then run the burr from the labial face into the palatal face all the way through, just like we did towards the mesial half. Okay, so here we go. Run through, and keep running the burr from the labial into the palatal. Keep running through, keep running through. All right, sometimes the fin tends to become so thin that it fractures or fries away. Remember, enamel is brittle, right? So even if that happens, don't be worried, it's okay. As long as your adjacent tooth is not hurt, mission accomplished. All right, and the thinness of this burr allows you to use it for all your anteriors and even for your smaller premolar teeth. All right, once again, run through. I'm almost through and through. Again, don't be in a hurry to do this. Go slowly, and you will be able to understand the importance of this burr and the importance of finishing. So we've opened up both your proximals, and we haven't hurt the adjacent tooth at all. Nice and thin fins is what we desire. Now what do? We have to break these fins. So we go ahead and we take a probe and then simply tweak these out. Okay, so this aspect can be taken care of from the palatal or from the labial, whichever, it doesn't matter. So all you need to do is you take your probe, you place it in, and then you simply tweak. And as you tweak, remember, because enamel is brittle, it will just simply break off. All right, see that, how it just breaks off? Do it towards the other side as well, and it completely breaks off. Now remember, at this point the margins are far supragingival and they are not smooth, but that's okay. We still have to go ahead and finish the preparation. But what's important at this time is the fact that you have made sure that your adjacent teeth are not compromised during this critical step of the procedure. Okay, now that we're done with labial and we're done with interproximal, the next margin that we look at is the palatal face. Now because the palatal face does not require as much reduction, what we do is we use a burr that is from the PFM cluster. which is the DC 1.0. Now remember, on the labial face, because aesthetics is more important, I need more reduction here. So that's why I am using the DC 1.4 burr here. But on the palatal face, I can easily use the DC 1.0, because even if I have less aesthetics in this region, that is absolutely fine. And because my patient is a very cooperative one, I'm going to go ahead and take the liberty of showing you this preparation directly from the palatal view. Alright, so the burr that I have here is the DC 1.0. Now when I am doing palatal preparation, I always try to keep my margin again slightly supragingival. Okay, now what's important here is the angle of this burr. Okay, so remember, this is the correct inclination of the burr. Typically, how do we relate this or get this angle? This angle is parallel to plane 1 of the labial face. Alright, so if this is the plane 1 of the labial face, I kind of hold this same angle and I come back, and this is the correct angle of my palatal reduction. Now why is this critical? Because if my angle were to change, let's say from here my angle tilted inwards a little, I'm going to create an undercut. On the other hand, if I go like this, I'm going to land up over reducing the preparation, landing up with an excessive taper. Okay, so it's important that we get the inclination correct. Now why is this more critical for anterior teeth? Because palatal surfaces need to be prepared under indirect vision. Alright, so just be careful of this. Again, it is with time that you get the correct understanding of the inclination, and it also helps to take advantage from the adjacent tooth. Alright, so this is your plane of the adjacent tooth. Make sure you carry the exact same plane here. What do? You once again, with a supragingival placement, go ahead and make a groove that is half depth. So automatically you get 0.5 of a millimeter. Right? And when you're working on the palatal face, you don't need to make 3 grooves. You can easily make 1 groove and then go ahead towards the mesial, go ahead towards the distal, and then connect this to the interproximal area, making sure you don't go ahead and nick the adjacent tooth. Alright, so let me start off with moving first towards the mesial, keeping the burr angle constant. I'm going to go ahead and define a margin here. Go ahead and merge it into the interproximal. It doesn't matter where exactly you merge it right now, just go ahead and merge it, making sure you don't touch the adjacent tooth. Alright, you now come towards the other side. You go ahead and do the exact same thing towards this face. Once again, making sure to stay away from the adjacent tooth. Alright, remember, conservation is the key here. We do not want to do too much preparation. But at the same time, what is very important is to get this vertical band here. Right? Remember, reading retention and resistance form. From here till here is where you get the retention and resistance form for your anterior teeth, majorly the resistance form. Now, if this surface is excessively tapered, okay, which means अगर आपका angle गलत हो गया, ये देखो ये सही angle है, this is your plane 1. अगर ये angle गलत हो गया ना, you will end up losing this entire band when you start doing your palatal reduction. So be very careful. Make sure this is reduced in the correct plane, and that correct plane, as I mentioned to you, is parallel to plane 1 on the labial face. This will make sure that you get what is called as an undercut free preparation. Right? At this point, if I were to go ahead and just clean this, I have completed the entire axial preparation. Alright, which means 360 degrees of the tooth has been prepared, but all this is very gross preparation. I still have to finish this. But at the same time, I still have to do incisal edge reduction and palatal cinguli reduction. So first I go ahead with the incisal edge reduction, and for this, friends, I will demonstrate to you the use of the IR 2.0 burr. Alright friends, so this is your incisal reduction burr, which has a functional height of 2 millimeters. So how am I supposed to use this burr? I'm going to go ahead and butt this surface against the incisal edge. right? And then I'm going to run from the labial into the palatal as far as possible in one single stroke. Okay, so I take this and I go ahead and run through. Right, don't bring this downwards like we used to do for the incisal, rather the interproximal surface. So I run through. Right, this gives me a 2 mm groove, not more, not less. Right, I go ahead and make one more here, through and through, from the labial into the palatal. Right, so remember both of these grooves are an exact 2 mm. Right, now this is how you can quantify the amount of labial reduction. What is another way? Another way is the conventional protocol that we had learned, that we take a burr and we sink the burr 1 mm into the incisal edge, go ahead and reduce that edge, sink another 1 mm and reduce the incisal edge. Inadvertently we'll end up under reducing. However, with the help of this IR burr, you can absolutely quantify the amount of reduction. Alright friends, now what I have done is I have switched my burr to any long burr. What I am using here is a DC 1.0. To be very true, kaun sa burr use karte ho, at this point it does not matter. Why? Because all you need to do is just orient this burr at an angle like this. Alright, orient this burr at this angle and then go ahead and remove the enamel prisms that stand above this groove mark. Alright, so look what am I doing. Just orienting it at an angle and then slowly and steadily reducing this edge off, reducing that edge off, reducing that edge off. Okay, so I've connected this groove basically to the first one. I now go ahead and do the exact same thing for the second one and now the third one. Right, now I have gross incisal edge reduction of 2 mm. Now what helps at this point is to keep the burr at quite an angle. As you can see, I'm keeping the burr almost flat and then running through so that you can connect only the higher areas and not land up deepening the actual groove, so that you don't land up with over reduction. Alright, so just connecting these together. And I am done with my incisal edge reduction. Right, the only surface that now remains per se for me to do gross preparation is this surface. And what do we use for this surface? We use the American football burr. Alright, so this is my cingulum reduction burr. This is the 2.8. Remember, we want the wider one for your maxillary central because the tooth is larger in size. Now what is extremely important is the correct inclination or orientation of the burr. It is said the fattest area of the burr should sit into the deepest concavity of the tooth, which means this is your ideal positioning of the burr. Now it is not uncommon for clinicians to land up holding the burr like this. Now if you do this, you land up under reducing this portion and you land up over reducing this portion, and then you get a very thin fin of dentin remaining. What happens if you over taper this? You will again land up over thinning this and not adequately reducing this surface. So remember, the correct inclination is this, not this, and definitely not this. Okay, so you start like this, you move from side to side, and then as you keep coming up, you hold the burr in that state inclination and simply follow the same path in a side to side motion. This will give you the same concavity that is originally present in the tooth structure. Okay, so I'm going to hold the burr in the correct fossa position and then move side to side, side to side, side to side. And as you do this, you will see that you are beginning to reduce tooth structure. Once again, be very careful not to hurt the adjacent tooth. It's important that we follow the same architecture. Side to side, side to side, side to side. Alright, now when you do this, it's extremely important. As you can see, this concavity which is present on the palatal face is maintained. Okay, portion is very important, friends, that the original concavity of the tooth structure should be maintained, and at the same time the incisal edge should not be thin, but at the same time it should also be following the same curvature of the anterior quadrant. Okay, with this all 360 degrees of your preparation along with the gross reduction is complete. This is the time when you go ahead and start finishing your preparation. Alright, so to finish the labial face of the anterior teeth, we actually use the widest burr in the kit, which is the DC 1.8F. Remember, when you sink this burr half depth, it will automatically give you the 0.9 millimeter margin that you desire on the labial face. And at this time, you can easily take the margin that is supragingival to an equigingival level. Now remember, this burr only and only runs the labial face on the cervical margin and on the plane 2 of the labial face. We don't put this burr interproximally because this burr is fat, right? It's going to hurt the adjacent teeth. So we will use a thinner burr for proximal and palatal reduction, but we use this particular burr for the labial face selectively. Alright, so I start with plane 1 of the labial face. Once again, making sure that I hold the burr in the correct angle. Alright, slowly I keep taking my margin cervically, and I keep smoothing the preparation. Alright, now it helps to do this particular step under magnification, because when you can see a larger area, it just helps. So I am someone who personally enjoys using loops. Anywhere between a 2 and a 4x magnification is all you need. But what's important is, as you can see, I'm slowly and steadily taking my margin cervically and coming to an equigingival or an equicrestal level. Alright, if I were to just air blow, you can see a cervical margin that is now equigingival. But more importantly, as you can see, the cervical margin is now fairly thick and uniform. It may be a little rough as yet, don't worry, I still have to go ahead and smoothen the plane 2. But as you can see, the labial margin is no longer supragingival but has become equigingival in nature. And I now run this burr across the plane 1 and plane 2 both, right? Keeping at a slight angle, just run across so that you can smoothen the surface. Plane 1, plane 2. You don't want an extremely distinct plane 1 and plane 2, so you can easily go ahead and smoothen that junction out. Alright, this is where we are through with finishing of the entire labial face. Alright, as you can see now, everything is fairly smooth. You still have a plane 1 and a plane 2, right? But the plane 1 and plane 2 are no longer too prominent, but they merge from one into the other. So you can see an equal amount of the cervical and an equal amount of the incisal surface of the adjacent tooth. Now that I'm done with this, I will now move on to the interproximal surface, and for that we will be using another burr, and that burr, friends, is the DC 1.2F, which is a finishing burr that is actually a part of the PFM cluster, but we use it for interproximal reduction and for palatal finishing, even for anterior teeth. Okay, this is where I have now taken the DC 1.2F burr, and I'm going ahead and I'm going to smoothen the proximal surfaces, make sure they are nice and rounded, and also the fact that they are supragingival, so I'm going to go ahead and make them equigingival. And you can see the burr just about clears through the adjacent area. Now, if you're concerned that you're going to go ahead and nick the adjacent tooth at this time, feel free to go ahead and place a mylar strip here so that the adjacent tooth does not get hurt during this critical phase of the preparation. All right, so once again, just run from the labial margin into the interproximal. Right, sometimes it helps to come from the palatal to the labial, right, because when you do this you have a little more control over the papillary tissues, and you will make sure that you don't land up lacerating them at all. Right, so labial to palatal, palatal to labial, and at all times making sure the adjacent tooth is not hurt. All right, so just run through. Okay, you will then achieve a nice margin on the proximal surface, and at the same time your adjacent tooth is not hurt. Okay, so we do the exact same thing towards the other face as well. Right, I am now going from the labial distal into the palatal, and I will also come from the distal palatal into the labial. Alright, just keep running through. Make sure all your lateral pressure is towards the tooth that you are preparing, so that your burr does not slip off towards the adjacent tooth at all. Alright, you don't want to be hurting the adjacent tooth during this critical procedure. Alright, so just run from the labial to the palatal, and I'm also running from the palatal into the labial. Alright, and then you can round these edges off, make sure everything is smooth. Very important is also smoothing of the incisal edges. So what I do is I hold the burr at a slight angle and just run through. Alright, keep changing the angle a little, and as I run through you can see that the incisal edge is beautifully rounded here and it's still very sharp here. So once again I keep the burr at an angle and just run through on the incisal edge. Slowly and steadily, keep changing the angle a little bit as you do this, and you will be able to achieve a nice smooth rounded margin. Right, these angles are not supposed to be sharp, so we've kind of rounded them off beautifully. Now we go on to the palatal face, and this again is done under indirect vision. I am fortunate that I can do this under direct vision, and this is because it's more for a demonstration purpose. So what do? I again hold the burr here and keep moving proximally, and I'm supposed to round the edges off, supposed to make sure there is a smooth free flowing margin everywhere. Right, and go ahead and connect this into the interproximal margin that I have prepared from the labial face, through and through, all the way through. Right, these edges that you see here are supposed to be rounded off, so I'm going to run the burr a little and round these edges off. Just run the burr a little and round these edges off, and then hold the burr at the incisal edge and then run across so that I have a nice smooth uniform preparation. Right, I see a slightly thick incisal edge in this region, so I'm going to go ahead and slowly shave that portion off. Right, but this is where you can see your gross preparation now kind of showing through. At any point if you feel your reduction is not even, you can use an occlusal mirror because it gives you a 360-degree view of the preparation, and you can simply make sure that your preparation has uniform margin width going all around. This is not just to do with the uniform margin width, but also the fact that there is an overall gross uniformity in your preparation. Your incisal edge is fairly centrally located, right, and you have a general smooth surface all the way through. Now it helps to check this with the help of a putty index before you go ahead and smoothen the preparation with a yellow ring burr if you are doing an Emax based restoration. Alright, so I'm going to go ahead and show you with the putty index the amount of preparation that we have achieved. All right, so here I have my pre-treatment putty index, and I'll go ahead and orient it onto the tooth that we have prepared, and then check for the amount of reduction. All right, as you can look from the side, we have a fairly uniform reduction on the entire labial face. Towards the cervical, towards the middle, and towards the incisal face, the amount of reduction is very, very uniform. That is what you desire in terms of a plane 1 and a plane 2 preparation. Also, when I look at the incisal edge has been reduced adequately, which means I don't need to reduce the labial face or the incisal edge any further. Where it becomes difficult with this gauge is the palatal reduction. And friends, this is exactly where the prep gauge comes into the picture. Friends, this is the 1 millimeter prep gauge, which is yellow in color. Now, as you can see, I have oriented this along the entire incisal edge and the palatal surface. Now, when I try to pull through, as you can see, this comes out without a lot of resistance, right? Now that tells me that there is adequate amount of clearance that is present along the entire palatal face. Now, if this were to hold very tight and not come through, if it were giving me excessive amount of resistance, it tells me the amount of reduction is less and I need to reduce more. Now, this is the beauty about the prep gauge, because it tells me whether the clearance is adequate or not. However, it does not tell me where the clearance is less. So what I can do is, on the prep gauge right here, I can apply a paint. The one that I use in my practice is called RT Spot. It's a paint that is available from the company Bausch. You apply it, place it there, have the patient bite down, and you can even tell the patient to make the entire protrusive range of movements. And if there is any form of red marking that is visible on the palatal surface, that surface selectively needs more reduction. So you can go ahead and reduce only and only that particular area. Right now, once you have gauged all this, which means all 360 degrees of your preparation is done, as you can see on the proximal surface, the margin is still a little wide and it's still not equigingival. All right, you can clearly see that here. This is where your end cutting burr comes into the picture. Alright friends, this is the end cutting burr, and as I mentioned earlier, it has diamonds only and only on the tip. Now you can clearly see this margin is supragingival, and when I use this burr to kind of move a little bit, it only and only selectively takes the margin down, and even if this burr touches the adjacent tooth, I am not excessively concerned. Why? Because it's not going to create any destruction there. So I selectively move the burr. And as you can see, it's slowly and steadily taking my margin to an equigingival level. Alright, I'm going to do the exact same thing on this side, just a little bit, so that I can take my margins equigingival. And once I have done that, I can come back with my DC 1.0 burr and just go ahead and round that edge off. Alright friends, here you can see that the margin has become equigingival, but definitely the architecture is no longer deep chamfer. So what I need to do is I need to now go ahead with my deep chamfer burr and simply round this edge off to make sure that we regain the desired architectural design of the margin. So that's exactly what I do. Just run a little from the labial into the palatal, into the labial, and do the exact same thing here. And in just a bit, I will share some pictures with you of how the final preparation looks. Alright friends, this is how you want to end your preparation. As you can see from the labial face, we have an equigingival preparation on the labial margin. As I come towards the proximal, you can see the axial walls have a good 3-degree taper to it. When I roll towards the side, you can see there is a plane 1 and a plane 2 to the axial preparation. As I come towards the top, you can see all 360 degrees of the margin clearly visible with no obvious undercuts. The incisal edge looks uniform in thickness and ideally placed along the circumference of the incisal profile. As I come towards the palatal face, you can clearly see there is a palatal concavity that matches the adjacent tooth. You can see that the palatal wall is nice and straight, and then you have a palatal margin that is slightly supragingival. So friends, this is ideally where I want to leave my anterior teeth preparations in order to receive a metal-free prosthesis.
All right. Okay. So friends, I hope you guys enjoyed that video where I have, in a very systematic, stepwise, organized manner, shown you how to go ahead and prepare an anterior tooth. Right, friends? So just follow this basic recipe and be rest for sure that your preparations will look good. Right? And if you use the correct armamentarium and the right tools, you shall find predictability in your preparations. जो कहते हैं ना, जब तक try नहीं करोगे तब तक समझोगे कैसे whether this works for you or not. So I would strongly urge you guys to start using this kit that I have put a lot of effort and a lot of love and passion into preparing, and these prep gauges that will help you gauge or quantify the amount of reduction. These are available, as you can see, on the website, that is mikdental.in. And also there is a contact number if you wish to purchase these offline. But remember, the basic concept about the Bur kit is, एक बार अगर आपने यूज किया है तो दोबारा जाके उसको वहीं पर डालें. So make sure you put the burr back into the exact same slot, because if you interchange the burrs, the concept is gone. All right, so put the burr back into the same slot, pouch it, and then you can even autoclave it. Remember, that is very important in the COVID world today, that we don't transmit infection from one patient to the other. All right, so these were your gadgets or your tools that you use for your preparation. But my friends, I take utmost pride in presenting to you something that I have penned down, which is a book called as Clinical Fixed Prosthodontics. This is currently in its second edition, where we have a starter and master volume. The starter volume caters to all crown and bridge basic procedures, with the master volume catering to full mouth rehabilitation, tabletop dentistry, implants, and more advanced procedures. Right, if you want more information on crown and bridge dentistry, just sharing with you the index page of this book, friends. It is a colored atlas, right? So a lot of slides that you saw earlier today have come directly from this book. So if you want to go ahead and look at a preview copy of the book, that's available once again on the same website, that is mikdental.in. And if you want to go ahead and call for it, because it will change the way you practice your dentistry, going from how to choose the correct material, to how to choose the shade, to preparation of a central incisor, of a canine, of a premolar, of a maxillary molar, mandibular molar, lower anterior. So everything has beautifully been incorporated into this book, along with topics of shade selection and shade communication, which I know a lot of clinicians do struggle with. Right, so that will give you a lot more in terms of information for basic crown and bridge procedures. And that's not it, friends. I am excited to share with you that this is a webinar series